Hey guys, this is Dr. Jim Ferguson of Todd Ferguson Chiropractic, and I just wanted to come to you today and explain why we see patients the way we see them. A couple of weeks ago after my explanation, I had a patient kind of laugh and he said, I thought you saw patients that frequently because that's the way the insurance companies would pay. And there is a method behind our madness, if you want to call it that. And so whenever the spine is injured, a couple of things are going to happen. The very first thing that's going to happen is everything's going to get locked down with muscle spasms as a protection mechanism to guard the vital spinal cord and neurological components of the spine. That the guarding and protecting of the spine is the number one reason of that. And so what happens is that these muscle spasms will come in and lock everything down. That is a normal protection mechanism that the body has built in. However, it's kind of like a double-edged sword. It cuts both ways. We have on the back of the spine here these small joints. These are called facet joints, and these are synovial fluid joints. They're lubricated by synovial fluid, which is produced by the synovial membrane. The synovial membrane produces fluid on demand. Whenever you move, it says, oh, we need more lubrication, so it's going to produce more. If we don't restore motion back to the spine within 72 hours, the synovial fluid can change from a WD-40 like substance to a thick gummy paste within just a couple of days. And that gummy paste is then the perfect medium for collagen fibers to grow. And when they grow from one side of the joint to the other, you then have what's called an adhesion. And when the adhesions are grown from one side of the joint to the other, now that joint is basically welded shut and can't move. If they can't move, if the joints can't move here on the back, guess what? The disc can't get nourishment. Now what we're going to do here is we're going to have another video here in a few minutes to explain how this can proceed to years of disc degeneration and how it pays negative dividends for the future. But here's the thing, guys, you can't exercise the back into movement. You can't stretch it back into movement. It's only a chiropractic adjustment that goes in and breaks those adhesions and restores the motion, the proper motion back to the spine. So here's the thing, you either take care of your health or you're going to be taking care of your illness and your pain.